Hi guys, so today I'm going to talk about loop diuretics. Though I have done this topic before, a few people wanted me to do this again. So I tried to create this video again by simplifying it so it'll be easy for you all to understand, and by the end of the video you will understand what is loop diuretics better. And also I will be linking the previous videos in my caption and also about the Frusemide, and also I will be adding the link for the mind map where you can see about the loop diuretics. So do not forget to check that out, and also if you feel that it's going to be useful for your friends who are doing this course, you can also share with them and also it will be helpful for them. So without further ado, now let's get into the video. So the first we are going to talk about the diuretics class is loop diuretics are to remove excessive fluid in the body and especially in the peripheral edema. So this is the first class that I'm talking about, and about the other classes I will be talking about it in my next videos. Also I have previously done it if you really want to watch it. And this image right here I have given you all indicates a loop to loop diuretics. They block the transport of sodium and water at the ascending loop of Henle in the kidneys. But before we get in there, let's talk about the drugs that are related. So example, Frusemide, Torsemide, Bumetanide. And so these drugs are really common and used really frequently. So if you want to know more about Frusemide, I have attached the link below where you can check the video. And also the drug which I mentioned is not really common. So what it does is act by inhibiting the NaCl reabsorption in ascending loop of Henle. This drug also blocks the sodium, potassium and calcium importers. Therefore, it increases the elimination of sodium and calcium through the body, and this acts on the indications. So indication in a sense, particular if it works on the hypertension, if it works on the particular area, what it does to that particular area will act. So if you increase the dose, it may also cause dehydration. If the drugs which I've told you before, if you increase the dose of that, it might cause dehydration because too much of excess fluid is being removed from the body. So when you give these drugs, there can be elimination of potassium, calcium, magnesium also happens. So did you reduce that? You can give potassium sparing diuretics to reduce excessive removal of potassium, and also the other drugs like calcium and magnesium, if there is anything, then you have to react upon that. Then they increase the reabsorption in uric acid in PCT. So let's see how they work. Loop diuretic is the fastest acting diuretics upon in their classes, and it acts after 30 minutes to 1 hour after administration. And the loop diuretics work on the kidneys, more especially on the loop of Henle, to cause reduced iron absorption and water loss into the urine, therefore more diuresis. So if you're going to try something you're super scared of, you might piss in your pants. So well diuretics mean that the diuretic increases the urine production to remove excess fluid from the body. The most common instance when diuretics are used is peripheral edema, pulmonary edema, hypertension. All of these cases can be thought of a situation of volume overload which you can relieve by removing fluid from the body. So most common thing you should know is you shouldn't give diuretics in the evening as it will cause several bathroom trips at night. So I hope that is obvious, and many people know about that. And if you want to know more about Frusemide, please do check out my video which I will be linking below. Potential adverse effects. High doses of diuretics can cause inner ear issue or ototoxicity, which manifests ringing in the ears or hearing ability. The risk of ototoxicity is increased when the drug levels increase. If the patient is experiencing ototoxicity, then you may ask the doctor to reduce the dose. Loop diuretics may cause lower the levels of potassium by excreting more potassium, so they cause hypokalemia. Low potassium levels can cause life-threatening issues. So it's always best to get the right dose from your doctor, and if you feel there is something wrong, please do check with your doctor and make sure to get treated right. And I hope you understood what is loop diuretics. So this is all of that, and if you want to know more,
do not forget to subscribe to my channel, and I will also be linking the other links for loop diuretics and also the mind map link. And also please do not forget to subscribe and also hit the bell icon. Thank you.